The 2019 nCoV, also better known as the novel coronavirus, is one of the scariest new and unknown viruses originating from Wuhan in China. The WHO says it was alerted to this virus on 31st December 2019. The virus did not match any other known viruses, and therefore there is a crisis unfolding across the world because as yet we don't know how it affects people. On 7th January, Chinese authorities officially confirmed that they had identified a new virus. The coronavirus has been categorized in a family of viruses that include the common cold and viruses such as SARS and MERS. The number of cases both in China and other countries have been rising steadily, and finally this week, the WHO has declared the coronavirus an international public health emergency. 100 cases have been confirmed in 19 other countries, including the first cases in Tibet, India and Britain. Thailand and Japan have the most cases outside of China, and the virus has spread as far as USA and Canada and Australia. The Chinese are struggling to deal with the outbreak and seems ill-prepared, even though it has dealt with the SARS outbreak not so long ago. Medical supplies are short, especially in the poor areas in the Hubei province, where the virus originated. On the other hand, the world is also marveling at how the government has built a new 1,000-bed hospital within 10 days in the now quarantined city of Wuhan, and has vowed that another new 1,300-bed hospital will also be ready by the middle of February. This was done during SARS outbreak as well, when China built a new hospital in Beijing in just a week. So it's a rather bizarre contrast. Chinese primary healthcare system struggling to deal with patients, but at the same time the mighty Chinese system also putting up large hospitals in record time. It's turning out to be rather challenging to deal with the outbreak because the virus can spread before any symptoms appear, meaning carriers may not even realize that they're infected before they transmit the virus to others. China has now urged its citizens to postpone all trips abroad. Some countries, meanwhile, have stopped issuing visas on arrival to Chinese nationals. Many countries, including India, are now curtailing their flights to and fro China. The USA has now told its citizens not to travel to China, even as heightened security and checks at airports continue all around the world. Hong Kong has closed a range of public facilities, from sports centers to campsites, in a bid to curb the spread. All recreational facilities will be temporarily shut to avoid people gathering. Even as several countries are evacuating their citizens from China, the country itself has said that it will also send charter planes to bring back Hubei province residents who are overseas. India now has 3 confirmed cases of the coronavirus, all of them in Kerala, and all of them of students who have returned after studying in Wuhan. Out of 104 samples tested till last week, 3 have tested positive. Nearly 2,000 people who have a history of travel to China and other affected countries are under observation in Kerala, of whom 75 have been kept in isolation wards. The Kerala government has now declared the coronavirus a state calamity. Airport screenings and precautions are also being taken at all major airports. An Air India 423-seater jumbo plane was sent to China to evacuate around 400 Indian citizens from Wuhan. Screening of the Indians from Wuhan at the airport will be done by a joint team of Armed Forces Medical Services and Airport Health Authority. The procedure of screening and quarantine will comprise 2 steps, the first one being screening at airport, followed by quarantine at Manesar, and if any individual is suspected to be infected, he or she will be shifted to isolation ward at base hospital in Delhi cantonment. ITBB has also created a 600-bed facility in South Delhi. Monitoring will be done for 2 weeks. As of today, there is no identified treatment. There is no vaccine. In fact, we don't know much about the virus at all. But the WHO has shown confidence in China's abilities in controlling the spread.